Welcome to the Healthy Careers Podcast, where we help healthcare providers succeed on purpose. We take a conversational approach in learning from others who have been there and done that. Join us as we share expert insights from real people who are just like you, because we believe that success isn't just a destination, it's an intentional journey, and you don't have to do it alone.
All right, super excited about today because we have somebody that is an experienced PA, specialized in orthopedics, which is near and dear to my heart, as many of you know, but also somebody that is a leader in the orthopedic space and has taken it upon himself to earn additional certifications as well as his doctorate of medical sciences. And he is a leader for the residency program with his practice, where he helps to help PAs to hone in on their orthopedic clinical skills. So welcome to the podcast, Jason.
Hi, thanks for having me.
Yeah, of course. Awesome. So like many of my guests, we connected first on LinkedIn, and I really admired everything that you have done as a PA. I like to say you were a PA before being a PA was cool. And you've been able to transform your career into something outside of just the clinical aspect. So I want to talk about that, talk about residency, who it's for, why someone might choose to do that. And also just a little bit about your own career and what got you to this point.
Okay. Well, those are my favorite things to talk about. So
Awesome.
I'm here for it.
Great.
One of the things you mentioned was like, who should do a residency? And it's funny, I think that there's a really easy button to go, everybody should, but that's not true, right? It's just not. I think it's going to become more and more prevalent, right? There was a study like in 2020, I think there were 72 APP residency programs across the country or something, spread across like lots of specialties. There are more than that now. But I think it's really going to become sort of a next step for PAs who want to go from being a generalist into a specialist, right? I don't know that there's a residency need to stay a generalist, but to be a specialist, I think there is, right? PA school is really broad and you learn a million things about a million things and you come out of it only knowing this much of every specialty. And I think a residency sort of broadens that scope by a lot by giving you just a fire hose of, at least in our specific instance, orthopedics, where I'm going to give you 3 years of orthopedic knowledge in 12 months. And you're just going to cram it all in your brain and come out of it fast forwarding to where you need to be.
Yeah. I think that's key too, because so many times when I talk to people that are new grads and I ask them a simple question of, which clinical rotation did you enjoy the most? And they're like, well, I can tell you which ones I didn't like, but I felt like when I was in someone, maybe it was orthopedics or whatever it might be, where they felt like they did enjoy it, they were gaining momentum, they were learning. The second that they started to get comfortable or feel like they were advancing within that specialty, boom, they're done. They're on the next rotation. So it was like they didn't get enough to truly understand, is this the specialty that I want to go into? And if it is, am I 100% ready to go and be the best clinician in that specialty that I can be? So I think that's where, if somebody does express interest in a more, in my mind, intense specialty like orthopedics or cardiothoracic, they would really benefit from getting that additional exposure experience before just being, sent to the wolves as a day one new grad PA.
Yeah, I think, PA school really preps you for boards, right? Like that's what it's designed for. School is there to prep you to pass your boards because you have to have such a breadth of knowledge. And then once you do that though, like clinical rotations for me are a lot like cake tasting before a wedding or like a wine tasting, where you're going to get a little bit of like 10 different things. And then you're going to pick the one you want and change your mind 6 times in the process. Right. And then you come out of it. And a lot of new grads are in the scramble for, and you know this, right? Because you do recruiting, like whatever I can find, right? I need a job. I need one now. Student loans are coming. I love orthopedics, but every job posting I see says you need 800 years of orthopedic experience to come work as an ortho PA or whatever. And you don't know what to do, right? So your options are family med, urgent care, a job off of your rotations, or luck, right? And residencies, I think, are a way for people to not decide if they like something. That's the wrong way to do it, man. Residencies are too hard
Mhm.
to be a decide if I like this thing. But if you know that you have a passion for sports medicine or oncology or urology or whatever, I think a residency is a great way to do it because it gives you protected academic time alongside on the job training and clinical skills, alongside at least the good ones, mentorships and relationships that you can build, whether you stay working with the practice that you are a resident with or not, right? You come out of it with some networking. And if you have the right leadership and mentor group, a little bit of personal and professional development, right? Medicine is way
Yeah.
more than diagnosis and treatment, but you don't learn anything except that in school. And I think residencies are a way to sort of broaden your life skill gap a little bit.
Yeah, and I'd be curious to hear from your own experience. Do you find that the majority of people that are doing the residency with you are new grads that are looking for additional seat time, if you will? Or are there also people that maybe are coming from a different specialty and realizing I've been in urgent care, I've been in primary care for 10 years, but I have an interest in orthopedics. The beauty of being a PA is that you can make that change from one specialty to the next. But the last time that I did ortho was 10 years ago in my clinical rotation. What is that split that you typically see?
For us, it's disproportionately new grad heavy, right? Not everyone,
Okay.
but the majority of the residents who come through our program, I say new grad slash early career, right? So somebody
Okay.
who's been doing something for a year, maybe, or 6 months as their first out of school job. And then sometimes you have to wait, right? If I don't have a cohort open, you don't want to not work. So you do some urgent care work or whatever until you can come to the cohort. But we've had a few who came from, like I did some more urgent care work before I came here, and I worked in like vaccine clinics during COVID before I did the residency part of things, right? Um, and I have a couple of people who have completed our program now who came from like pain or so that's ortho adjacent, right? It's not real ortho, but it's ortho
Right.
adjacent. That stuff is way too
Yep.
hard for me, so good for them. Um, a little bit of family practice, and then some from some other ortho practices. We have a couple of residents that have come through our program who worked in other orthopedic groups, and they learned really quickly, like, oh man, this is not a rotation. I am not a student. And one of the things that I didn't mention yet, but I think is probably true about residencies, is it protects new grads from the expectation that sometimes supervising physicians or practices have of their PA, right? Where you come out of school and people go, cool, well, you know your stuff, ready to go. And you don't, right? And
Mhm.
and I think without strong leadership inside of any practice, new grads will flounder, and residencies give you a chance to spread your wings a little bit. We have really high autonomy expectations in our residents, right? Like once you pass your boards, like I tell them all the time during the interview process, PAC, C means you have to see people on your own sometimes, and that's okay, right? You're a provider now, and you got to
Yeah.
learn to do that. Um, but it's inside like this safety net, and I think that that's a big thing where the workload is scary and the amount of information you have to take in is scary. But you know that there is someone, whether it's the director like me or your mentor that you're assigned to or your physician or whoever that's right there beside you, that one has a vested interest in your success, right? I don't want you to fail. It makes us look bad if you don't succeed, right? But
Yeah.
also who has been to where you are and has done what you do, which is different when you have dedicated PA to PA mentors or APP to APP mentors than if you have physician to PA mentors. Not that there's anything wrong with that dynamic, but there's a strength to I've done what you're doing and helping
Yeah.
teach people that.
Yeah, I think that is really key. And it's not to say that there can't be a really good collaborative dynamic between a physician and an APP. But I also think that PAs are not new to the healthcare ecosystem, but there's still a lot of misinformation about how they're valued. And I think there's a lot of people that are not forward thinking to see how that dynamic can be. And so having somebody that is a PA to be your mentor and to ask questions and to have there alongside you is so key, because sometimes I talk to people that they'll run a job offer by me, and we don't work with any urgent care places, but I had somebody say, "Oh, I'm going to be working in this urgent care and there's a medical director on call if I need him, but I'm going to be there by myself as a new grad." And
Yeah.
I'm thinking, why would you want that? I mean, talk about an absolute nightmare for you if you don't know, or if you have a question and you've got a patient in front of you at waiting for answers, right? And also from a growth perspective, you mentioned something that I don't think a lot of people think about, but is so key in not just the here and now, but what do you want out of your career is the networking. You are not going to be able to become your best, most optimized clinician on your own. You're just not. You've got to learn from others. You've got to build those relationships. And if you're not doing that or don't have the opportunities because there's nobody else that you're working with or partnering with, it's going to be very short-lived. So as you mentioned, I think residency does just that, is it allows people to meet, collaborate, network, and understand their role before just being tossed into something.
Agreed. It also teaches people to be continuous learners because like we have an expectation of academic success during the program, but quite frankly, clinicians have to be that way regardless, right? Whether you do a residency or not, whether you're 1 year, 5 year, 10 years, 30 years into your career, you have to learn every day. You have to know how to keep up with medical trends because your patients are going to show up and ask you questions. And you have to know that maybe the way we did it 30 years ago is the way we should do it today. Maybe it's not, right? And I think that the younger people are, and the age range of PA school graduates is getting lower and lower, right? Like people are getting really good at undergrad, a year of patient contact, PA school. I'm 26 years old. Here I go. Right. And I took a really non-traditional path to PA school, which I think in some ways gives me some strength after graduation in that I lived a lot of life. And then I went to PA school, right? I worked a bunch of jobs. So my perspective on interpersonal relationships and leadership and things like that is a little different than it was when I was 26, 27 years old, right? So I think something that I can't speak to other programs like our residency in specific, and I know that Duke and a couple of the other ortho ones do the same, really focuses, we use 3 pillars, right? We do academic, clinical, and then personal professional development / leader development, right? And they are all 3 equally weighted in the program because I think that something that's not taught, I know is not taught in PA school is how to navigate becoming a leader, which is an expectation of PAs. You're a clinician, people look to you, right? I don't care if you're 1 day on the job or 2 weeks on the job or 6 years on the job. They go, "Ooh, clinician, what do I do?" Right? And that's terrifying when you don't know what you're doing. So we try to help develop some of that, a little bit of self-awareness and personal professional growth and a little bit of business savvy, right? That's the other thing PA schools, I think right now miss the mark on. And I've talked about this with several program directors across PA schools where there is a lack, and I think it's just a time thing. There's not enough time to do it, but understanding how health insurance works, understanding what billing really looks like, not just you put in the 3 or the 4 code, but like, what is billing really, right? What does that mean for the patient that you're sitting across? Nobody knows, right? Like, and so I was shocked when I went through the residency and I got taught, like, here's how billing works. Here's what insurance looks like. And I went, wait, what? That's how that works? And it opened it made me a better clinician because I understood the other side of the room better, right? So that's part of what we built into our program because whether they stay on and they're providers with us here at Direct Orthopedic Care or they go on and they're ortho PA somewhere else, they're better clinicians and better humans when they come out of it. And that's what ultimately we want, right? Because it makes medicine better, makes the profession better, advocates for us as PAs.
100%. And I think 2 points that I kind of picked up from what you said there is discernment. A lot of times in medicine comes with experience. And there are many ways that you can go about, fixing something in general in life. But the more experience you have underneath your belt in all areas helps you to understand, like, there's not just one answer. There could be 3. Which one do you use in this situation? And that's something that you don't naturally have. I mean, it's just, if you could go back to your 16-year-old self, boy, the things that I wouldn't do, right? Or would have done. But then again, how do you mitigate that? Residency is a great way because you are learning more than just, like you said, to pass pants. And on top of that, a lot of what I try to advocate for on my end is because I am a recruiter, because I work on both ends with the candidates and practices is understanding, market insight, right? And understanding how to advocate for yourself. And if you don't understand the back end of how things are built or how a practice is growing revenue and what your role is in that, how are you ever going to be able to advocate for yourself when it comes to pay raises or understanding your productivity? Because they might measure it for you, but you should also be able to measure it for yourself. Like, don't wait for
Right.
them to tell you, here's your numbers, right? Like, you've got to be able to say, I know what I produce. I know my value. So I know that if I'm getting paid X amount, I'm either middle tier or under average. So I know to go and advocate for that pay raise or look for a new job. And that is something that I think so many people just get so busy in the rat race, they don't even think about it.
And they don't know to think about it, right? Like,
Yeah.
I had a conversation not that long ago with a resident, and we're talking through just numbers in general and what clinical revenue looks like and things like that. And people go, "Ooh, money. I don't want to talk about that." Well, healthcare is a business as well as a calling, right? It's both.
Yeah.
And they had come from a different practice before they did the program. And they're like, "Well, we never really talked about this there." I was like, "You didn't talk about it, but somebody did. And somebody talked about it
Yeah.
about you without you in the room." Right. So the more we can be educated about who we are and what we bring to the table, because PAs top to bottom are valuable and sometimes underutilized because they're not understood, sometimes
Mm-hmm.
underutilized because it's just a money game, and sometimes underutilized because people are afraid, right? There's a little bit of all three of those things going on. And I hate the narrative that APPs want to be physicians and that there's this battle back and forth between docs and PAs. There shouldn't be, right? Like, and there is, and I get it. And it goes both ways. Like, both sides of the fence sometimes kind of lean into that the wrong way. But I think top of scope,
Yeah.
right? Practicing the top of your scope as a PA and the autonomy that you have there and the bandwidth you can bring to a practice and to your collaborating physician and to your community is too broad to be ignored, right? Like, if you
Yeah.
don't know how powerful you are, somebody needs to tell you. And there's something
Mm-hmm.
about that. I don't want to brag on residencies all the time, but there's something about that that comes out of it too. You learn real fast how great you are
Yeah.
and where you can grow. And so I think that that's probably the true strength. It's not the didactic knowledge, it's the repetitions and the self assurance that really make programs succeed and people who come out of
Mm-hmm.
them successful.
Yeah. I agree. And I think too, your point about just the value that you provide and kind of the scope creep, if you will, around PAs and NPs makes sense. But it's like there's no PA that's going out there trying to act as an MD.
Right.
And if they're utilized correctly, I mean, everyone benefits, right? And I think there's still a lot to learn about all of that and advocation towards how do we create that environment and get everybody on board, which I definitely want to talk about with you. So I guess now would be a good time to discuss. You do a lot of advocacy for the profession. So what does that look like on your end? And how do you also try to integrate that into the residency program?
Honestly, sometimes it just starts with having grassroots table to table conversations, right? I
Mm-hmm.
volunteered at my state constituency organization for a while. I'm currently applied to volunteer in a few things with the AAPA. But honestly, I think my biggest impact has been talking to my peers, talking to my residents, having conversations on social media around, like, decisions are always being made all the time. You decide whether they're made around you or with you, but they're happening one way or the other. And so you
Mm-hmm.
see a lot of the interstate licensing compacts that's been talked about, or change in the language of agreements from supervisory and collaborative, and all of this stuff that AAPA is pushed for. The title change, right? That's a huge thing in the last several years and
Oh,
whatever.
yeah.
The title change didn't change a thing about what we do. Not a single
Mm-mm.
thing. All it did, what, in my opinion, personal opinion, doesn't endorse my job, all that stuff, right? Like, all it did was change people's understanding of who we are for the better,
Yeah.
right? Like, for the better. And a perfect example of this is if I search for a job on LinkedIn, right? I search my town name plus certain radius plus physician assistant, right? I live in Texas, so associate's not the title here yet. And so we search under assistant. I get like half and half MA jobs and half PA jobs because that's just how it
Yeah.
breaks things down, right? And people read
Yeah.
it that way. I don't care what you call me. I prefer people call me Jason, right? Not PA Lee, not Dr. Lee in an academic setting. Like Jason is fine.
Mhm.
But advocacy starts with education and understanding what's happening with your profession. And I think the head in the sand version of it isn't great. Quite honestly, I didn't know a lot about it and wasn't super involved until I did my doctoral program with Lynchburg, and some of the classes that you have to take as part of this program. One of them is healthcare advocacy, right? And you have to
Okay.
like read and write letters to your state senate and all of this other stuff. Watch these things and make social media posts. And then I did some additional classes because I just found it really interesting, and it just blew my mind, the things that don't get talked about. I'm really excited for AAPA in Houston here in a couple months. Just the opportunity to get down and talk to
Yeah.
other people who have been making decisions and been moving and grooving. And like some of my classmates are super involved in like the national organization. And it's something that I'm starting to get into now that I've sort of settled out how the residency's running and everything. Like I have good footing, so I have some space to be
Yeah.
more involved on a bigger scale. But it's important because if you let somebody else tell you
Yeah,
where
you're
you're
not
going,
busy enough.
yeah, it's all relative, right? If you love what you do, you never have to work a day in your life. That's what they say,
Yeah.
right? Um, I also have 2 teenage daughters. It's fine. Um,
Yeah. You've got
no,
all
but I
the
really
time in the world.
believe that we have a responsibility to be
Mhm.
informed. You don't have a responsibility to volunteer or be involved. If that's your passion, do it. But you should be informed, because when you're not, and then decisions happen that you don't agree with, that's on you, right? You didn't
Yeah.
know, you didn't care. Um, so no, understand your value and then share that with other people, right? Like you said it earlier, it
Yeah.
makes everybody better.
Yeah. And I think too, correcting people, like I'm not a PA, but I will call practices because I see an open position. Like this happened the other day and I hate to use the word flabbergasted, but I was flabbergasted. Like I called, they had a physician assistant role posted on Indeed. So I pick up the phone, I do my business development, I call them, I say, "Hello, my name is Madison. I want an advanced scope. We're a small orthopedic recruitment firm. Saw your job posting. I have somebody that I'd like to introduce you to." They said, "Physician what?" I said, "Physician assistant." They said, like medical assistant, is that what you're asking about?"
Right.
I said, "No, ma'am, I'm sorry. The physician associate, this physician assistant, is the person that works collaboratively with the doctor. You might call them nurse practitioners. I don't know if you hire NPs or PAs or have a preference, either or." And she truly didn't know. I mean, and this is somebody that's a practice manager with an orthopedic practice. So I had to somewhat educate her, right? And then in my mind, I'm thinking, I'm not recruiting for this firm because clearly the PAs are not respected and valued there. But in the same term, it's crazy to me that someone still to this day doesn't know that when the profession has been around for as long as it has been.
But somebody in that practice, an APP on some level, maybe they don't have PAs, I don't know, does know,
Yeah.
right? And their
Right.
doc knows, but the conversation's not happening about the value that that person brings. And I said earlier that all clinicians are leaders by default. Some people shrink away from that and go, no, no, my job is diagnose and treat, go home, right?
Mhm.
Diagnose and treat, go home, which is fine, right? I don't want to denigrate anybody who is happy with that role in their life, but I think that there's a space where if you're the only PA that your practice has ever had, to have that conversation, sit down with the
Yeah.
practice manager and the medical director and your collaborating doc and go, hey, it's not even always a money thing. It's just, this is what we do, right? This is who I am.
Mhm.
Put me on the little placard that's out front next to the doc, right? Say, Dr. Smith works here and PA Smith works here, right? To clearly
Yeah.
delineate, but put the picture there because your patients are coming to see me, right? They may
Right.
be Dr. Smith's
Exactly.
patients on paper, but they're seeing me in the room. And so
Mhm.
if I can talk that through, the flip side of that is the responsibility of PAs to make sure they identify themselves as PAs and make sure that they help people understand their role in a practice, right? Because that's where I think some of the negativity comes from is there's all this passion for this is what we do, this is who we are, let's go, let's go, let's go, let's get it out there, let's tell everybody. And I think it's sometimes mistaken as, well, we want what you have, right? And I don't
Yeah.
think that's true, but it's communicated poorly.
No.
So
Mhm. Yeah, and I do think that's also a good sign. I've when I visited clinics, when I see the plaque and it's just the doctors, like you've got to have, APPs, mid-levels, however you want to call them, they should be recognized too. Because like you're saying, anytime that I'm going to the doctor, I spend the majority of the time with the NP or the PA, not the doc. The doc might come in for a few minutes and that's great, but that's a collaboration and it's not, one can't work without the other. And that's where I think, like you're saying, so many people miss the mark and thinking that PAs are trying to take over. And then, docs thinking that PAs aren't equal or able to help them in the ways that they truly can, especially if they've gone through something like an orthopedic residency and honed in their surgical skills. There's no reason why they can't be first assist and be right there next to the doc. But it's, like you said, advocating and informing. And I think it is that, everyone's responsibility if they're a PA to speak up about that, I think a lot of people don't want to ruffle feathers or make a scene, especially if they're greater in their career. They've just landed a job and they feel like, oh, I'm not being utilized the way that I could be in this practice. What would you suggest? Like, how do they go about that conversation?
First, get informed. And if you're not sure, I've actually talked to classmates from PA school and then residents as they leave our residency about this. Understand what you can do, right? Start there. Like what you can do, what you should be doing. It's a little bit different from practice to practice. So you have to understand the practice's view on APPs and things like
Yeah.
that. But it starts with, and the best example of this is PAs who go to a practice who has never had a PA before, right? If you talk to them,
Yeah.
you get one of two experiences. The first being, they had no idea what to do with me, so I mostly sat around all the time and nothing happened, right? The second one being,
Mhm.
they had no idea what to do with me. So I told them, here's what I do, right? And here's how I can help our practice. And now they employ me in that way. And that same person becomes a lead APP at some point or a director of an APP group. One of my faculty way back in PA school came in and talked about this, right? She said, I was the first PA to ever be part of this department at a major hospital system. They didn't really know what to do. So I made my job. And then now we train
Mhm.
people in the model of this job that I made. Not everybody wants to do that, but if you're going to be the first one there, you kind of have to, right?
Yeah.
That's just how it works. And that's what I mean by advocacy, right? You asked about that earlier. It doesn't have to be national media or local constituency organizations.
Correct.
It can be advocating for yourself in a room or for your peer, like that second PA that you bring on to your practice alongside you. Like that's where you can advocate.
100%. I think so many times people see advocation as standing outside of the White House with big posters or standing outside, doing protests. But the most impactful thing that you can do to advocate, not only for the career, but yourself, is to start exactly where you are. And if you're in a practice where you feel underutilized, try having that conversation. And if it goes sour or it goes south, reach out to me. I'll find you a new job. But um, I mean, I do think that also will give you a very good indication that if you've taken a job where you've tried to explain it, you're still being underutilized, and it's just not surfacing, like nothing's coming to fruition from those conversations, from that advocation, that is a good sign that maybe you're not in the right spot and maybe you do need to switch practices and or do something like a residency to be able to network and find where you can truly add value and optimize your career.
And network. You're 100% right. Right? You don't have to leave
Yeah.
your job. You don't have to go to APA. You don't have to do a residency. There are PAs everywhere. Reach out to them.
Mm-hmm.
Connect on LinkedIn. Use the huddle thing if you're an APA member. Reach out to your alumni organization. Google some and send them
Yeah.
an email. Right? And if you're not
Yep.
sure where you fit into a practice or how to grow inside of your practice, send that message that says, hey, I'm a PA doing this. And I'd really love to know how you do things where you are. Right? I'm not coming for your job. I'm not trying to take your patients. Really, what I want to know is how do I
Yeah.
get to do what you're doing? Right?
Mm-hmm.
Before I went to PA school, I interviewed a bunch of people trying to decide what I wanted to do in medicine, right? Be a PA, be an NP, be a doc, whatever. I asked two questions every single person, right? And I interviewed probably 50 people. And I said,
Wow.
what do you love about your job and what am I going to hate about it? Right. And as we talked through all of those things, what I came to realize is that it was never the job. the title, right? Doctor, NP, PA. It was always whether or not whether they felt safe, whether they were comfortable with what they were doing, and whether they felt empowered to move forward in some way. And so the only way you can do that is to see other people do it and do that thing, right? 1 in 10,000 people is going to be the individual trailblazer who just makes everything up and they fix it. They do it all on their own. Everybody else is going to kind of see what other people are doing and use that as an improvement metric. And I think the more PAs are good about that, right? Find a mentor, find a friend. It doesn't have to be in the same field, right? I do orthopedics. If you live around here, if you do urology and you want to know how I got where I am, call me, reach me on LinkedIn, ask me questions. Like I'm happy to bring people up, right? We rise together, we fall alone. And so it's just a thing people have to get comfortable doing.
100%. I think too, that's something that is in any career, in my own mentorship is, I like to say it's like having instruction guides to an IKEA piece of furniture. When you go to IKEA and you get it and it's just all these things and letters and stickers everywhere and you're like, I don't even know where to start. I don't like reading. So for me, it's like, I don't want to read the instruction guide. But if you have a mentor that's saying, hey, I once tried that. And when I did this with this, it worked. But when I did that with that, it did not. And you're like, okay, well, then let me do it the way it worked. And you save yourself having to fail because you just had somebody that you trusted and that you were vulnerable enough to say, I don't know this, but I'm willing to learn. And I want to learn from you because I see how you've been able to get from A to C or whatever that goal is that you have. And I think it's great that there's people like you who have rose up in the industry and advocated and become not just clinicians, but leaders and people that have really moved the needle, no pun intended, within what they're doing to be more than just what they went to PA school.
Yeah, I think so. I think it's important and broad perspectives matter, right? Like I tell everybody, you should have a mentor who does what you do. Maybe not your specialty, but who does what you do. But you should also have some that aren't, right? The people I brainstorm with about career moves and ideas, I'm a big brain idea human. So I always have a whiteboard full of, should I try that or not? But some of the people that I brainstorm with don't work in medicine at all. They have no understanding of how the medical side of things work, but they're idea people. Right. And then I have PA mentors that I lean on and I go, all right, look, I want to be like you when I grow up. Right. And so if that's the case, what steps did you take to get to where you are? Right. And how can I do my version of that? And I think it's important. And it's funny, the AEPA has this thing called Mentor Match as part of the membership if you're part of the national organization. Right. So I clicked on this thing and I put it out there and there are some people in it and there are some, but on my end, at least, it's very quiet. I haven't heard or seen anything about it. And I don't know if it's people are afraid to use it or they're just not looking for what I do or whatever, but there are ways to find people, right? LinkedIn is great. Going to conferences is great, right? Like if you go to a conference and you don't shake hands with somebody that you don't know and get a name and a phone number or an email for when you come home, you did it wrong. I don't care what you learned while you were there. You were wrong. The more we do it,
I go to
the more we
conferences
get
and
bigger.
I just walk around and I say, oh, what are you doing here? What's your booth about? And you talk to them and it could have absolutely nothing to do. I mean, they're selling medical devices for a specialty that I've got nothing to do with. And I listened and I'm like, okay, very nice. Cool. I'll add you on LinkedIn. And 3 years from now, they could be, all of a sudden within my wheelhouse and boom, you have a relationship there. And that's where that networking piece for not just what I need now. And I think that's something that I found as a recruiter, this upcoming generation is very much so just laser focused on here and now. And, I'm not old per se, but something that my parents always taught me is like, you have to plant seeds. You can't just do what you need in the moment now. And if someone doesn't service you, whatever, that follow-up communication and just those relationships that you build are what's going to make you successful no matter if residencies are great. And I think it offers you that additional networking piece, but no matter what letters you have next to your name, it comes down to your ability to build relationships.
Yeah. I mean, look how I met you. It was a random post on LinkedIn. And I was like, that's a cool thing that she said. So then I clicked a button and I watched it. And I was like, man, that's really cool. And it was literally, hey, this thing you did was great. And then it was, oh, cool. You want to do it? And I was like, sure. I like to talk. No problem. And now, one, we've had this great conversation. I've listened to several different podcasts that you've done now. And I'm like, oh, cool. Now I have this relationship that I didn't have, 60 days ago? And
exactly.
it's not going anywhere, right? Like, I know, like, if I have people looking for an ortho thing, I can reach out to you and go, hey, that's what she does. She's the expert in this field, right? And it's great. It's just another friendship tool that I can put in my toolbox and lean on if I need it, but also just hope you're having a great week. Like those kind of things, right? Like it maintains this, I don't know, your network matters more than I think people give it credit for.
For sure. And I mean, working is hard. If it wasn't, it would be called vacation. So having positive people, no matter what you do, is good for those days when you wake up and you're like, wow, I don't know if 15 coffees could get me through today.
Exactly.
Yeah. Awesome. Well, this has been fun. I think it's helped me understand residency more because you're the first person that I spoke with that runs and leads this type of program. So I think that's incredible. And I would also advocate people that are listening, if you're thinking of maybe doing residency and you're not sure, reach out to Jason and pick his brain on a few things. I'm sure he'd be willing to share with you his own experience because he's trained from a residency program and he now is able to see the, fruit from his own labors of how he's helped other clinicians become more than just what you learned in PA school.
It's awesome. Like it is, I am so much more than myself. And that's my favorite part of my job. Yeah.
Teaching others, it humbles you and it also makes you realize how awesome you are at times.
Every day.
Yes. Awesome. Well, thank you so much for your time today, Jason. It's been great. And again, if anybody here is listening and interested, both of us are always open to a conversation and we hope it's been helpful. Whether you're somebody that wants to move into leadership, wants to get more surgical experience, is exploring a residency and or wants to advocate and doesn't know where to start. So until next time, thank you so much for coming on the podcast.
Thank you. It's been fun.
Thanks for listening to the Healthy Careers Podcast, where we provide a platform for you to ask hard questions and get real answers. If you enjoyed this episode, don't forget to subscribe and share it with your friends. Stay tuned for more episodes every other Friday at 7 a.m. Eastern.